Thank you for joining us for this episode of CNTV. I'm Brad Clonch, along with Quin Tran. The Chickasaw Nation Department of Health encourages more people to get vaccinated for COVID-19.
Check the web address on your screen for the latest information and to register for the vaccine. The Chickasaw Nation is offering COVID-19 vaccines to all Oklahomans at any of the tribe's vaccination locations. The new COVID-19 Emergency Operations Facility is now open. It's located on Craddock Road in Ada, Oklahoma. The 40,000 square foot renovated property is the Chickasaw Nation's COVID-19 Incident Command Center. It can help facilitate coordination among local, state, tribal, federal, and other emergency management systems. Right now, it's serving as a drive-through COVID-19 vaccination site, accommodating up to 16 lanes. We recently connected with a panel of healthcare professionals with the Chickasaw Nation to talk about COVID-19 vaccinations and their impact on our community.
I've also got some volunteer nurses who have assisted with our mass vaccination, and they come from out of state across the U.S. and received very much comments of compliments and just amazement of what we have to offer here, because that's not what they're seeing in their states. So just getting that feedback from our volunteer nurses. Another example is an elder couple who drove from Houston. I had made a phone call to let them know, could we possibly move their time? And when they let me know how many hours it would take to get to their time slot, I was just amazed that they drove from Houston to get their vaccine. And I kind of wanted to be present when they arrived, and I got to meet them. And again, just so thankful for the opportunity that they were able to get the vaccine as they were not in their hometown.
We've had patients drive a long distance that have can't get it in their local communities. And it's a blessing with what the Chickasaw Nation is able to provide. We've been able to procure the vaccine. We've been able to vaccinate pretty much any of our patients that want it. We want to just get as many people vaccinated as we can, no matter where they come from, where they're at, because that's how we know we're going to get past this.
I'm just going to give the example that I shared with my mom. She was really afraid to get the vaccine, all the rumors that she's heard, what it's made of, what it could do to your body. Once she did get vaccinated, and my dad was able to get vaccinated with her as being a spouse of an eligible patient, I did let them know, possibly I get to come visit you more. So that was kind of an incentive for my parents. It was probably a couple weeks ago when she did receive the vaccine. My dad let me know that she did cry as she received it because she was very scared. And both of them are just fine. They're doing well. And I'm glad to say that my experience let them know that they were going to be safe if they received the vaccine as their daughter. The more vaccines we get and the more population we get to serve, then that data will be able to tell us and maybe make a guesstimate of when we'll return back to normal.
Dr. Burden-Greer, have you seen an impact that the vaccine is making already?
We've certainly seen the COVID hospitalizations go down, that's for sure. We've gone from dozens of patients to a few. The last 7 nights I've been covering the hospital, and this is the longest stretch that I've gone without admitting a new COVID patient. I went 7 full nights in a row without admitting a new COVID patient. And that is something that I can't even remember the last time that happened. Definitely, if you get the vaccine, you're part of saving lives. So that is one thing, preventing the spread of COVID is huge, and this is the way that we're going to do it. The other thing is, leading by example. All of us are getting vaccinated. I think that builds confidence in the community. If they see their doctors and nurses and pharmacists getting vaccinated, they look to us and trust us, and they know that it's safe.
Dr. Burden-Greer encourages those who have had COVID-19 to get vaccinated just like she has. She will get her second dose this month.
In the next episode of CNTV, we'll continue our conversation with this panel of healthcare professionals. They reflect on the past year as we reach the 1-year mark of the pandemic. The Chickasaw Nation is hosting a virtual event to honor those who have lost their lives to COVID-19, complications from the disease, or other tragic events during the past year. Visit this web address to submit information about your loved one. The information needs to be submitted by March 17th. Loved ones will be honored during the first Chickasaw Nation COVID-19 Memorial Service. Kensha Walker is a Chickasaw nurse from Louisiana. After recovering from COVID-19, she went back on the front lines to help patients with the illness.
Over the past year, Kensha has traveled to hospitals outside of her home state to help medical teams in need. As you're about to hear, her work goes beyond caring for patients. She is a healing connection to their families.
I could not function if my parents were sick in a hospital and I couldn't at least hear their voice. So I had one patient that I was taking care of in a step down unit. And it step down is one step from the ICU with that could very well require all of the intense treatment of the ICU. And I was led that day to FaceTime with her daughter. She had been confused, but she was really sick and she was on oxygen, requiring a great amount of oxygen. And I FaceTime with her. And her daughter. And I didn't know. I just felt the need that morning when she got up to get her daughter on the phone. And I thought I would be okay, but just hearing them talk with each other. And, it's almost like I just put myself in their shoes and I couldn't imagine it. And I thought I was strong enough to do it. And since being a nurse, I've become a lot tougher and stronger emotionally. But that was one visit that I thought I could really handle. And I called her daughter and they FaceTimed and I had to end up apologizing to her because I said, I'm the nurse here. I'm supposed to be strong. They were from Oklahoma. They lived in Oklahoma. And the patient's husband had recently been discharged from the hospital with COVID. And so she was encouraging her mom to get better so that she could get home with her husband. And they had been married over 60 years. And I felt that she was going to get better. I felt that, okay, we're going to take all of the steps necessary to get you home. And that was my encouragement to her. But the daughter didn't ask me to call her. I was led by, and I know it was God, I was led to call her that morning. That was her last time speaking with her daughter. She started getting progressively worse that same day, and it was a few hours after that she passed. It has been such an honor to take care of these patients, and I've built some tremendous relationships from supporting the families and these people. Some I don't see, but I talk to them and I stay in touch with them several times throughout the day.
Kinsha Walker's care and compassion for her patients means so much to their families, so much so that a family made a donation in her name to the hospital in Tyler, Texas, where she served.
Healthcare heroes have worked tirelessly during this pandemic. We want to spotlight now a team at the Chickasaw Nation that some call unsung heroes. They're on the front lines to make sure COVID patient rooms are clean and safe.
Before we go into a COVID room, we have infection control and other parts of our department that make sure we're educated. We have what we need. Our maintenance department go in and they evaluated the circulation of airflow. So we know we wait an hour. Once the room's discharged, we don't go in it till an hour after. We wear gloves, we wear a N95 mask, and we wear goggles. And we go in and we perform what we call a terminal clean. It's the same type of cleaning we would do on a room before someone has surgery. We go in, we clean the walls, we clean the ceilings, we clean every little square inch. Our chemical that we spray, it takes us about an hour. We have to spray all the surfaces down with either Halt or HDQ, and then it sits for 10 minutes before we can wipe the surfaces down to make sure that everything's cleaned. We do glow testing where we have a chemical we can go in and we spray before the clean, and we can go in with a black light after to make sure all the surfaces were completed. That process really helps us with educating our staff, and it shows accountability that we're not just picking on certain areas. We did the glow test. This is what happened, just so they can see, because it's really hard to know. We've got to do every light switch, every little piece. So for that education and them to see, and then when they have a complete success, it's so great. Like, you didn't miss anything. I do respect all of our team that's going in on the front lines and taking care of our patients and making sure the room's safe for the next patient, the next employee, whoever's going into that room. But it is also hard working in health. You know, you see all these patient rooms full, and we work with staff, and then you see people that you love get it, and then you have to navigate. You know, you just cleaned a room and you know the person just passed away, and learning how to handle those emotions with the nurses and with us, and coming in like it's a new day and keeping that positive personality for the next patient, even though it's very hard. Sometimes I think it's really good to look at all angles of it, because I think that's the hardest part for my team with COVID, is the amount of deaths we've seen, the amount of loved ones we've lost, employees we've lost. We see that firsthand. We see the person come in doing okay and then going on a vent and moving from acute care to ICU. And it's just, that's the hardest part of COVID, I think, for us to navigate, more than us being fearful of ourselves going into the COVID room. I think we're used to cleaning C. diff and lice and bed bugs, and we're used to that kind of dynamic. I mean, we're used to going to a room after people get flu, they have tuberculosis. I mean, we go into all these rooms and clean after any type of illness. So I think the death is the hardest.
Her team works very hard. It's a group that also includes landscaping. Besides maintaining the beautiful grounds of the medical center, the landscaping team also takes care of the maintenance and resource needs, such as generators for the medical tents for testing sites, and pediatrics.
We will spotlight more healthcare heroes, people serving throughout this pandemic. Look for their stories in upcoming episodes of CNTV.
March is Women's History Month. We're taking this time to introduce you to Chickasaw women who are making a difference in the lives of others.
Meet Elizabeth Ruhle, a college professor, Chickasaw researcher, and writer. You have the best of both worlds. You are assistant professor at George Washington University and also the director of the AT&T Center for Indigenous Politics and Policy there in Washington, D.C. Would you say that you have the dream job?
Well, it's certainly my dream job. I knew that coming up through my education, I wanted to work with and for Native people. I wanted a way to give back to my own community and also learn about our people and the issues that we face as contemporary people. And one of the early examples I had for that spirit of service was my father. He worked as an attorney and still works as an attorney representing Indian tribes. And so for a long time, I thought maybe I would follow in those footsteps and go to law school. But actually, when I was an undergrad, I had a lot of really great mentors, and they showed me this new world of academia, research, writing, teaching, and that really sparked a new type of fire inside of me. I ended up pursuing a PhD right out of undergrad, actually, and ever since then have been working as an academic, as an administrator, and as a faculty member. I have the pleasure of teaching courses related related to Native politics and federal Indian law. These subjects are really important to me because oftentimes our Native people are misunderstood as just historical figures, but my focus is really focusing on contemporary Native issues and our contemporary Native people. One of the areas I specifically focus on in my own research are some of the issues that Native women face. So I look a lot at violence against Native women issues, but I also have the pleasure of teaching a whole new generation of Native youth and non-Native youth about our issues today as tribes, as Indigenous communities. And all of that work, I hope, really supports tribal sovereignty and creates better understanding between our Native and non-Native communities.
Growing up in Houston, Texas, were you connected to Chickasaw culture and heritage?
I've always maintained a really strong connection to my Chickasaw identity. Actually the way that I got involved with DC, whereas that's where I currently live, was through my connection to the Chickasaw Nation. I participated as a graduate student in the Chickasaw Nation internship program for 2 summers. And that opportunity took me to DC. I was able to work in a federal office focused on Native issues. For me, being a Chickasaw woman means that I am part of a legacy of strength, resilience, bravery, and innovation. I love learning about and drawing inspiration from our Chickasaw ancestors and our Chickasaw history. Being in our Chickasaw tribal territory is so empowering, and it's also just a wonderful, beautiful, vibrant community.
You're a teacher, you're a historian, a writer. There's an incredible sense of duty and honor to be able to write about history and policy so that the next generation has it to read and to know.
That's exactly one of the reasons I got into this line of work, was because I really saw the transformative positive change that could come out of the creation of new knowledge and also the dissemination of new knowledge. One positive change or one new piece of information can have a transformative effect, right? It can cause someone to think in a new way about a topic and maybe spark an interest that leads them down a path. I think all of my work really focuses on a couple of major themes, really emphasize the idea that Native American communities are here, and we're not only here in the present moment, but we're thriving. And I think that, the Chickasaw Nation is a great example of that, prosperity that contemporary tribes can have. And I also want people to understand the power that their history has upon their contemporary moment and their future as well. There's so much strength and inspiration, lessons to be learned from looking back into our history and where we've come from. I hope that everyone gets a sense of that excitement from my work.
We admire her passion for her work. We know that right now she's working on 2 books. We'll stay in touch with her and keep you posted on those publications.
Well, we've enjoyed sharing with you this episode of CNTV. Quin and I will see you back here soon.